lot of people might be affected with these white spots. With these white spots, you will have a problem with your confidence levels. If it is affected on your exposed areas, you feel that everyone is talking to you, but they are looking at those white patches. It is not the right thing. Yes, you feel that, but it's not happening that way. But always your confidence takes a beating whenever you have these kind of white spots. For these white spots, do we have any treatment options? Are there any good medications? Or do we have any advanced therapies for this? Yes, let us know about these things in detail today. The most important thing about vitiligo is that first we have to bring in stability. What kind of vitiligo patches do we usually see? We see white depigmented, that is a chalky white kind of colors can be seen with these vitiligo patches. And these patches can expand in size or they can occur on any other side of the body, and they can also expand and you can see multiple lesions happening all over the body. So there are different types of vitiligo. Like if you have only in one area, it is called as focal. If it is on generalized all over the body, it is called as generalized vitiligo. And in case if you have it on the fingertips or on the legs or even on the face, then it is called as acrofacial type of vitiligo. In some individuals, there can be white patch with the hairs turning white, that is called as leukotrichia. Now, what are the treatment options we have for this vitiligo? We have certain medications, that is the creams we have tacrolimus, pimecrolimus, topical corticosteroids, and of course you have calcipotriol and placentrex combinations also. Now, in these kind of combination therapies, you might get better results, but the best results are seen with the immunosuppressants, that is the oral medications. In oral medications, we can have some corticosteroids or azathioprine, methotrexate, cyclosporin and other medications. Now, these immunosuppressants, they are actually immunomodulators. They modulate the immunity which is eating away the melanocyte. The melanocyte is depleted in those white patches. So, whatever antibodies or the autoimmunity which is targeting those melanocytes, if it is attacked by this immunomodulators and the immunomodulators modulate the immunity over there and make it a proper immune system where it does not attack the melanocyte. Thereby, the pigmentation is coming back onto the white patches. Now, whenever we start these medications, you see that the patches are not increasing in size and the newer darker brown color spots are developing in those particular areas. Now, because of this, you are getting far better results when compared to treatments which were done 5 to 10 years back. Earlier 5 to 10 years back, they used to apply a cream and then ask you to get exposed to the sun. But nowadays, we are doing excellent results with these medications. Now, there is a newer molecule called as tofacitinib, which is absolutely new into the market, and we are getting excellent results with this tofacitinib. And the safety profile is quite good, but you are supposed to follow us up closely with the help of blood tests, so that we can understand what kind of improvement is seen in this vitiligo lesions. Now, this tofacitinib, what actually it does is that it decreases the immunity in that particular area, but not in the entire body. So, with that, tofacitinib is giving an excellent results. Now, once the patient has developed stability in these patches, stability in the sense that the new patch is not coming and the existing patch is controlled. With that, what will happen is that the patient will have a chance to go for surgeries. Now, what are these surgeries? Vitiligo surgeries, you have different kinds of surgeries such as ultra thin spread grafting, suction blister epidermal grafting and melanocyte non-culture grafting. So, what we do is we take out those particular areas of the skin on the thigh and the other areas of the buttocks or the hands, and then we put it directly on the skin after ablating with a carbon dioxide laser. So, the melanocytes which is there on the skin, intact skin can spread onto that and can develop pigmentation on those areas. In suction blister, we suck some skin out and then make some blisters into it, and then we cut those blisters of the skin and then put it back onto the affected area after ablating with a carbon dioxide laser. Once this transfer of melanocytes happen, they get stimulated with phototherapy and the pigmentation happens over there. This is done only after you see stability in the skin patches, not when it is growing in size. This is one aspect. Now, the other opportunities for the patients is that non-culture epidermal melanocyte transfer. Now, this non-culture epidermal melanocyte transfer can give very good results when you are getting it done when the patients are not developing any new patches or when this vitiligo is stable. It gives you an excellent textural contour, and it gives a good tone of the skin. It looks absolutely natural. So that is the reason non-culture epidermal melanocyte transfer is giving us far better results than any other technique now. So in case if you are being troubled with confidence levels because of vitiligo patches, you should approach us and get the most advanced therapies done in Celesti Skin Laser and Hair Center. And I am sure you can find a cure if at all your lesions are stable, and of course we can give you the best results. We can restore the pigment in your skin as well as restore your confidence also. So see you at Celesti Skin Laser and Hair Center, Jubilee Hills, Hyderabad. Thank you.
बंदासन धीरे से अपनी बॉडी को आगे लेके आइए. ट्राई टू कीप योर फोरहेड डाउन.